Well, good morning or good afternoon, fellow classmates and Dr. Fleener. Appreciate y'all watching this presentation. I'm excited to get to discuss with you kind of a heavy topic, but one that's important in our world today. But I'll introduce myself first. My name is Ryan Summers. I am a student at Leavell College. I am going on my junior year right now, or I'm in my junior year, actually going on my senior year. And so got a few more classes left and I'll be finished up. I'm also a student pastor, so anything with students really has my heart. And so that's why I want to introduce the topic to you guys, which is the topic of adolescent suicide. Now, it's not a topic that anyone really wants to discuss because of how heavy and how emotionally driven the topic can be. But as you and I and all of those watching know, that this is a very important topic in our world today. Working with students, you see a lot of cases of adolescent suicide, a lot more than you want to see, and you see the effect that it has on families and communities. And it seems like each year there's more and more cases. So just in introduction of the topic, I want to just show a few statistics on the rise of adolescent suicide over the years, and just what the numbers used to be versus what they are now, what has caused that rise, some research and studies show, and then how we can be counselors and ministers to people struggling with suicide attempts, self-harm attempts, and other things like that. So a 1986 study found that 63% of a high school population, so this was a study done in a singular high school. It was thousands of students, but it was a very large high school. But it found that 63% of the high school population there reported suicidal ideation. So that was thoughts about suicide or any type of things like that. So furthermore, the study showed that 17% of that high school population had at one time seriously considered suicide. And of those, 14% planned how they would commit suicide, which is, again, increasing the risk factor, as Dr. Fleener in the textbook has shown us. And then 8% actually attempted suicide at least once. 3% made an attempt that resulted in an injury requiring professional treatment. And the instances it shows there could be from poisoning, something that would cause or require medical intervention beyond that. So if you think about a self-harm attempt that would have left you in a state where you have to have medical treatment. So 3 out of the 8% of those who attempted at least once had to have serious medical intervention afterwards. So these statistics show just the sad reality that adolescents are facing. Our high schoolers, our middle schoolers, our young people in this world are surrounded by suicide. They're surrounded by suicidal ideation. They're surrounded by the thoughts of suicide, a culture that is just, quite frankly, very suicidal. And this, again, was in 2014. We have a lot of reason to believe that those statistics would have risen here in the last 10 years with the advancement of things that we'll talk about later in this discussion. But COVID and just other forms of devices that I'll talk about here later, we have reason to think that those statistics may have risen. So for my research paper, I did a hypothetical scenario of a 14-year-old boy who has recently attempted suicide. His parents found out about the attempt and are trying to get him the help that he needs, as well as determining the underlying risk factors that led to this decision, the suicide attempt, as well as just prevention of any future attempts. So again, a hypothetical situation, but one that's not hypothetical for a lot of people. And so I want to be sensitive with that topic. But some of the things in the history about this boy is in his freshman year at his local high school. He's had a phone since 6th grade with social media on it. He's a baseball player, loves to hunt, but recently his interests have faded in both. In beginning high school, he's ran into some bullying. He's had some people that were messaging him over the social media and the phone. and the boy spends a significant amount of time, about 3 hours a day, on social media sites. But both of the boy's parents are together, alive, and married, and he lives in the household with them. So this paper in this presentation is about how bullying, social media, pornography, and other types of dopaminergic devices can have an effect on adolescents in a harmful manner, particularly in increasing risk to suicide and suicidal attempts. One of the benefits of doing a study on suicide is there's just an array of information and studies about this topic because of how big of an issue it is. So one of the studies that I looked at is just talking about treatment, talking about prevention after the suicidal attempt. So in our scenario, the 14-year-old boy has attempted suicide. He was not successful in his attempt, and so now the parents and the people working with him are looking for interventions to get him to a better spot mentally and emotionally. So Dennis Ogren and colleagues did a study involving about 2,000 youths, comparing the outcomes of therapeutic intervention with a placebo group, and it found that the therapeutic intervention did have a very positive result in regard to preventing future suicide attempts. So they would take a young person who had at least one suicide attempt. They would put in therapeutic intervention. They would study those placed next to a placebo group. They found that the therapeutic intervention group did have decreased risks of future self-harm. And so for this paper, I'm going to argue that one of the first things that the parents and the people working with this boy should do in his life is add therapeutic intervention into the boy's life. Now, there were three methods that the study by Dennis Ogren and colleagues described as being helpful for therapeutic intervention. Cognitive behavioral therapy was one of those, but actually the one with the most increase and the best positive results was dialectical behavioral therapy. So, but they were very similar. DBT, CBT, and MBT were very similar with respect to the positive results that they faced. But so in the follow-up period, the placebo group self-harmed at a rate of 33%, while the therapeutic intervention group self-harmed at a rate of 28%. So while that might only be a 5% difference, that shows that the therapeutic intervention is having a positive effect on the group at large. So therapeutic intervention is going to be the first thing that should be added into the boy's life. Another instance of something that can be added into adolescent's life that post a self-harm event, such as a suicide attempt, is looking towards antidepressants and other as well as therapeutic intervention. Now, in working with a counselor and a therapist, they would have much more expertise on prescribing antidepressants if that is the right scenario. But a study by Michael F. Grunbaum and colleagues in 2004 looked at the correlation between antidepressant prescription in the United States and suicide rates, and it noted that the increase of antidepressant prescriptions correlated inversely with suicide rates. So as antidepressants were prescribed at higher amounts throughout the general population of the United States, suicide attempts and suicide rates actually went down. So while there needs to be some more studies on antidepressants in relation to suicide attempts, it's noted in this paper that may be a good way to prevent future self-harm events in the boy's life, as well as in any similar rates. But as I said, this should be discussed with the therapist on specific prescriptions, as well as if they need a prescription to an antidepressant at all. But the correlation between SSRI prescriptions and suicide rates makes a pretty fine case that it should be at least evaluated. in the boy's life. So as you and I both know, throughout the last 10, 15 years, social media has become a huge part of the everyday life of Americans, and really of the everyday lives of people throughout our world. Pew Research had a study that found that most teens are using social media, and many are using it constantly. So and you and I both know that it's true. If I get to see a lot of middle and high school students, and they are on their phones constantly on social medias like Snapchat, Instagram, YouTube, Twitter, and all those different things. So a study by Natalia Macrinicola and colleagues discovered actually a positive correlation between social media usage and suicidal thoughts and behaviors. So that means that as teens spend more time on social media, they experience more and more suicidal ideation, thoughts, and as that increase of suicidal ideation and thoughts rises, we can probably pretty reasonably assume that suicide risk and attempts would increase as well. So at the very least, social media usage should be evaluated in the life of our boy, the 14-year-old boy, as well as just in his bullying. He's having some issues as the bullies reach out to him through social media. So it should be evaluated if social media should be removed from his life. Another thing to be removed is just thinking about the removal of pornography from the boy's life, assuming that he's exposed to that. So according to Bevel and Associates, 93% of boys are exposed to pornography before the age of 18. It's likely then to assume, although not 100% necessary, that we should assume, though, that our 14-year-old boy has been exposed to pornography. Pornography has been shown to have a profound effect on the dopaminergic system in our brains, especially at a young age as you're going through adolescence and puberty. And the dopaminergic system has been shown to be related to an increased risk in suicide. So as previously mentioned with the antidepressants, one of the reasons that they have been found effective in some cases to lowering suicidal risks is because they can help with the dopaminergic system, which has a profound effect on people's mental health as well as suicidal ideation and attempts. So we know that pornography has an extreme effect on the dopaminergic system. It's also been linked to aggression, which our textbook says is depressive suicide. One of the reasons, one of the four faces of suicide, actually shows that rage and aggression can be shown and acted out on oneself in response to things that they cannot control. So if pornography is increasing aggression in adolescents, then it might be reasonable to assume that it could also increase that depressive suicide that comes from an inner rage, maybe on someone else, but if it's a rage inside of them, then it can be used on themselves through suicide. So, and then the one of the things to mention as well is removing just any acts of bullying. So talking with the boy's school, looking through the boy's messages on his phone, whether that's through text or social media, Snapchat, whatever it is. But we know, and it's shown that bullying can dramatically increase the risk of suicide, particularly in adolescents. And that was shown through a study by Young Shin Kim through Bullying and Suicide, a review on the International Journal of Adolescent Mental Health. So bullying should be removed from the boy's life. I did write an integration plan, just that includes integrating therapeutic intervention. Dialectical behavioral therapy was shown to be the best option as far as results in the previously mentioned study, but cognitive behavioral therapy and mentalization-based therapy were also viable options that had similar results. So adding therapeutic intervention into the boy's life would be extremely helpful, and I would argue that a Christian counselor in one of those three fields should be addressed. If we're talking about a boy that's experiencing, he's attempted suicide, he's either he's accepted in his mind that to die is better than to live, I think it would be very, very wise, and I would argue necessary, for the boy to experience counseling from a Christian perspective, because Christian counselors can and will talk about worldviews. They won't just talk about the natural world from a secular standpoint of what's going on in the brain, how they can help the boy given the studies and research that they've done, which are good things, but they can also talk about the afterlife, the life to come, what Jesus did on the cross for the boy, and all those different things I find would be incredibly helpful to the boy. And I think that we would be doing a disservice to him in giving him a secular worldview counseling perspective. One of the major tenets of Christianity is that there's an afterlife, there's a heaven and a hell, and that Jesus died on the cross so that we might go to heaven. And I think discussing this with the boy could be very beneficial for any future self-harm attempts, but also just as well as in that disintegration plan, in that integration plan, we would disintegrate social media, pornography, and bullying, as social media and pornography have a profound effect on the dopaminergic system that's been proven to play a part in suicide attempts. And then bullying, of course, has just a very profound effect on adolescents as far as those attempts and ideation go. So just in conclusion, our boy is not in a unique situation. He's in a very common situation that we really hate to see happen more and more. But we're lucky that he was not successful in his attempt. And I think there's some great evidence to show that through therapeutic intervention, the possibility of antidepressants, as well as removing social media, pornography, and bullying, that the boy can be on a great path forward. Thank you all for listening to my presentation, and I hope you all have a great rest of your day.